Hello, can you hear me? I apologize. I'm not the most... Yeah, hello? I hear you. Can you hear me? No, I can't hear you. Wonderful. Is something muted? Is something muted? This is getting ridiculous. Jesus Christ. As we're even right to you. I don't... Something muted here? Unmute. Yeah, I don't have to tell you. This is wonderful. Can you call me? I'm sorry. Can you call? Thank you. This is strange. All right. How did this? Hello. Hi. I apologize. I don't understand why there's no sound. My speakers are on. I'm not very technical. I apologize. It's just strange.
It could be my platform. Sometimes I reboot, but since I can see you and I can hear you, we probably just keep going.
Okay, sounds good.
I'm a dental surgeon, and I see you were referred for a hiatal hernia.
Yeah, I'll tell you real quick. I went to the ER back on, it was this past Thursday. So that would be the 27th. And they themselves are very vague. They did give me a whole bunch of notes. They said it could be this, it could be that. We don't know. Keep an eye on it. And they recommended I see a a gastroenterologist. But then, as fate would have it, I already had a doctor's appointment that day. So I went to the doctor that afternoon. I explained I just got out of the ER. The doctor said, yeah, this looks like a hiatal hernia. And I said, that's interesting because my father had one of those. Back Christmas of 23, I had a torn inferior epigastric artery on the left side. And my mother had something like that. So when this happened this past couple days ago, I thought it was the same thing. It felt just like tearing my inferior epigastrial artery. But they said, no, the doctor said it appears to be a hiatal hernia after if you looked over the ER notes. So they gave me some words. It's some ibuprofen, like 600 milligram. Here it is. They gave me prescription strength ibuprofen. So I've been taking that, but this is the ER that gave me that. But they were sort of vague. Said, see, something about your gastrologist or whatever. The doctor said, no, it looks like a hiatal hernia, and he gave me your number. So here I am.
Okay. So the reason you came to the ER was what? Excuse me, was what?
It was, I think it was that Wednesday night and a Thursday morning. I was doing my taxes. I'm very meticulous. And I had noticed for the past few weeks, every time I coughed or sneezed, I felt a pain on the right side. I felt the pain on the right side. Last time something like this happened to me was about 14 months ago. Anytime I sneezed or coughed, I felt the pain on the left side. Okay? So 14 months ago, I ended up in the hospital for a torn inferior epigastric artery. So early Thursday morning, I sneezed. Now the right side hurt. I assumed, okay, maybe I tore this side of the artery. So my brother, early that morning, my brother had to go to work. He dropped me off at the hospital, and I told him, I think I tore my inferior epigastric artery again. It feels exactly the same. It's very, very, very painful. And after doing tests, they said, no, it's not your artery. They were vague. They said it could be this, could be that. And it was my doctor who said, no, it's clearly a hiatal hernia. So I was in pain. I'm still in pain now. I'm doing a little better-ish, but I dread sneezing. I dread coughing. I dread laughing at this point. The pain is, like I said, I've experienced similar experience with the inferior epigastric artery being torn to the left. It feels just like that pain-wise, but it's not a hematoma. I had a hematoma 14 months ago. This is, according to my doctor, no, he said the stomach is breaching the muscle wall and pushing against the lungs. I think that's what he told me.
Okay, we're gonna sort all this out. Some of it adds up, some of it does not. I do encounter abdominal wall arteries frequently in my hernia practice, and I also do foregut surgery. So we're gonna sort it all out. You had a spontaneous rectus hematoma in 2023.
Correct.
After some coughing, perhaps.
Well, again, it was the same thing. It was Christmas Day, and for about like a couple months, like 6 months, 6 weeks beforehand, every time I coughed or sneezed, it would get worse and worse and worse. And then Christmas Day, I think I sneezed or coughed, or I coughed, and that really did it. I couldn't move. I was twisted like a pretzel. I was in so much pain. At some point, I said, I got to go to the hospital, and that's when they said, yeah, you have rectus hematoma. They said it was odd. They say usually you don't get something like that unless you're in a car accident or someone attacks you with a baseball bat or you fall off the roof. But my mother had something similar. She was moving a piece of furniture once, and she ended up in the ER, and they said the same thing. They said, wow, it's very rare to have a hematoma and a tear in the rectus sheath, inferior epigastric artery, over something so minor. So maybe it was a congenital, I don't know. But when this happened a few days ago, it felt exactly the same. So I assumed, okay, history repeating. But they said, no, they believe this is a hernia. So. No. In 2023, the pain was on the left side. It was here, left side pain. Yeah, the hematoma, the inferior epigastric artery tear was on the left. I thought maybe I tore something on the right. This time it's on my right.
But it's like at the same level, sort of.
Well, it's a little different. At the time, I felt the same level. Now it's at a point where, when it happened back in December, I had to go to the ER. They put me on like morphine. They admitted me to the hospital. It feels a little better-ish, but it's still in pain. Something's clearly wrong. And every time I cough or sneeze, it really hurts. It's different. When I had the hematoma, I couldn't move. With the internal bleeding, I was all twisted up. And I just wait for the bad blood to dissipate over. This, I think, I'm starting to agree that it probably is something different because it's painful. But no, it's not quite the same as the hematoma. It was Christmas Day. They had a skeleton crew, and basically no one was there to do anything, so they just let me sit there for 2 days, and then they dismissed me and said, listen, we think you're fine because if it were really serious, you'd be shivering and near death, so we think it's going to heal up, just take it easy. So they basically just monitored me for a couple days, and sometime later I went back, and they told me, yeah, it looks like it's healed. Please do. Yeah. Because when I went to the ER this time, I told them, as they were admitting me, I said, I suspect a rectus sheath hematoma again. And they said, why would you think such a thing? That's so rare. And I said, well, I've had this happen before. Maybe I'm genetically predisposed. The ER didn't tell me much. All they told me is, we don't think, it's definitely not a hematoma. It's definitely not a tear in the artery. That's what they claimed. They said it could be this little thing in the lungs. It could be this, it could be that. Afterwards, my doctor said, no, this looks like a hernia. So I don't know who to believe or what's going on. The ER didn't tell me much. They said just keep an eye on it and take the ibuprofen. The doctor said, here's the number for you guys to, yeah. So what do we got here? This is...
Can you see the CAT scan?
Not really. It's kind of blurry. Can you do it one more time?
But do you see a screen that has a CAT scan on it, or do you see a screen that has a chart on it?
Neither. I see you, and I see a black screen.
Oh, I see that. Okay, hold on. So the telemedicine platform for video visits,
Mm-hmm.
the HIPAA compliant. It's just the technology so behind that of like Zoom and all that. So that's why it's clunky and annoying. But we'll make it through here. Let me see if this CAT scan will work. 2023, 2020. Okay, I'm gonna show you your old one first, just because it's so impressive, and you've probably seen it, but.
What do you mean by impressive? The hematoma was that big or that crazy, or what do you mean by impressive?
Yeah, it was big. I mean, generally they are managed non-operatively, even when they're big, but, something to look at that's interesting. Usually when I choose a screen, it just lets me choose my... Okay, it says entire screen. That might work. How about now? Do you see a CAT scan?
Yeah, I think so. It looks like some kind of image. Yeah, I guess. Yeah, it's a CAT scan. Yeah.
All right. So most important to understand is this is the spine because these are bones. These look like vertebrae back here.
Okay.
Back. This is your front. This is the right. Everything's flipped. So the right is on the left side.
Okay.
And the left is on the right side.
Okay.
So anything that
Okay.
So we're going to make our way down from the chest into the abdomen, and then we're just going to look at the abdominal wall, which is the front of you, and you can see already the left side has this. This is the rectus muscle on the right, the six pack.
Mm-hmm.
This is your disrupted rectus muscle full of blood on your left side. So this is 2023.
Yes, no, I know that. Yes, it was the left side. I see what you're saying. It's reversed. Yeah, so that I know. I fully follow. Thank you for showing me this. Yeah, okay.
So I'm just letting you know this is what it looks like.
Wow, like a balloon. Yeah, like a.
As it keeps going, because the sheath is sort of like all connected, and then this is your pelvis, your groin, and everything like that. So, 2025 here. The radiologist is going to talk about whatever they see, no matter what it is. So, we'll go back up to the stomach in a second, but your abdominal wall is completely normal on both sides.
Hence, that's why they ruled out a torn artery. Right.
Yeah, and you healed really, really perfectly from the old one on the left. It looks great. I don't see anything in the abdominal wall that explains your severe pain. Other things that happen on the right side are gallbladder issues. Your gallbladder looks like a gallbladder. It's fine. Usually that's more of a food issue anyways. This is your stomach here because you drank contrast, so contrast is bright white. And, they're saying that you have a hiatal hernia. I mean, this is your esophagus. Do you see my cursor? Do you see it?
Yeah, it's in the middle there. It's the esophagus. Yeah.
There's almost no significant clinical hiatal hernia here. So, I mean, they made a soft call, and then they said, couple things. So, they made a soft call because they'll call anything that they see. They'll just say it. Incidentally, maybe you have a little hiatal hernia, which is the definition of not a perfectly tiny little esophagus, just a little bit of stomach above the diaphragm during this shot while you were drinking contrast. It's really hard to say. Secondly, and most importantly, hiatal hernias do not cause abdominal pain the way that you're describing in any way. They cause severe, sort of nagging, long-term, years-long acid reflux burning behind the sternum and not abdominal pain. So we're not really, I don't know why you had right-sided pain.
Not had, still have currently.
I don't know, but it's not, we can certainly do the testing to look into your probably not hiatal hernia, but you have no symptoms. So I don't know if a gastroenterologist would even do those tests, but we can do those tests so that we can tell you for sure no. But I don't know why you have right-sided pain, because that's just not a typical presentation of a hiatal hernia.
Well, in fact, I did actually notice, for the weeks leading up to this most recent one, 2025, I have woken up with a lot more reflux, acid reflux, and sort of that acidic taste in my mouth. It could be unrelated, but I hear what you're saying. You don't believe that would cause a hiatal hernia, and you're not seeing any damage to the gastric arteries. So you don't think it's either. Well, because it's still right now. It's kind of sore. If I cough or sneeze, I was sneezing last night. In fact, I don't even like coughing anymore. It hurts. So what do you think it would be then? What would be? I can feel. What would be collapsed lung, or what would this be? Anything? Any other thing you speculate?
You see that on the CAT scan. So, you can see a little bit more of the hernia here.
It is.
A lot of people have this.
Wait, the hernia. Wait, I thought you said there wasn't a hernia. Now you're saying you can see a hernia?
Well, you can see a little bit of stomach, a little bit of a widened esophagus right here.
Okay.
But, these things aren't considered to be something to worry about unless they're clinically relevant. Because if you look at 100 people, 20 would have this on their CAT scan, and 2 would have this.
Right. Yeah. And if I wasn't in pain, I wouldn't care. But I think it is relevant in my case.
Again, your pain is not what we see from a hiatal hernia. It doesn't cause abdominal pain, abdominal wall pain. So, I don't know if you want me to follow, to go delve into this incidental finding of a possible hiatal and look at reflux with you. We have studies we can do. Or if you want me to delve into what's your actual problem, which is your abdominal pain.
Well, yeah. You can handle both because I
don't see an obvious reason that a general surgeon could intervene on for your abdominal pain, but I can certainly, try to direct you in the right place.
Okay, so what would you like to do then?
So, I mean, where exactly is your pain? Like, is it at the belly button level? Is it at the breastbone level?
It's right here, kind of like all in here.
It's all over there. Yeah.
All in here. Right now it's sore. If I were to cough or sneeze, it really hurts when I cough and sneeze. All in here.
Yeah. So it's really exacerbated by coughing.
Yes, coughing, sneezing, even laughing exacerbates it, yes.
Okay. How about eating?
Not so much, no.
Does anything make it better, like medicines or anything like that?
Hard to say. I've been taking the medicine they give me. I don't know, because I don't know if I didn't take this, would I feel worse? I don't know, so I can't say for sure. It's still sore. I've been taking this like they told me to, this ibuprofen. If I hadn't, maybe it would feel worse. I honestly can't say if this makes it better or not, but it's definitely not. I don't feel fine. I haven't fully healed. It's still sore when I kind of move or twist. It's sore right now, and if I cough, sneeze, or laugh, it's gonna really hurt.
Okay. Can you eat like a full regular diet? No
Absolutely, yeah.
Okay. So I don't feel the need to go down the gallbladder pathway. Right side deep, sometimes radiating to the back. Right
Yes,
side.
it radiates to the back. Yes, right now my back is okay. The back pain comes and goes. Thanks for reminding me. Yes.
You're not really explaining gallbladder pain. Gallbladder pain happens when you eat, and it's really more of an indigestion. It doesn't happen when you cough. You're talking about a mechanical pain.
I guess.
This is mechanical pain. This is not an internal organ pain. Internal organs are what I work on. So,
Well, how do you know for sure? Can I ask, not to be arrogant, how do you know for sure it's not internal organ pain? I mean, you say it doesn't sound like it, but, why does everyone else, I'm not saying you're wrong, why do they think it was a hernia? Like, they're just guessing, like, why did they send me to you, and you're telling me it's not your special,
so when you get a CAT scan, you find all these things that you didn't go looking for, right?
Right.
But you have to put it with your clinical findings. So your clinical findings are pain when you cough and sneeze, pain when you push against the abdominal wall.
Well, still dull pain now, just resting, but yes, intensified pain when I cough and sneeze, yeah.
So there is no hiatal hernia that causes that.
Oh.
We need to take that out. Told you that to get you out of the ER.
Yeah. No, actually, no. But actually, it was not the ER that told me that. It was the doctor afterward, also attached. It was the doctor who said, based upon this, I say hiatal hernia. I said, here's the number for yeah.
Well, I'm a hiatal hernia expert, and I'm telling you that your pain is not.
I'm not doubting you. That's not a doubt of you. I'm curious because this wasn't the ER trying to get rid of me. The ER was very vague. They gave me a vague. It was the doctor who said, I'm pretty sure this is a hernia. So the doctor was just wrong. The doctor misdiagnosed what you're saying.
They don't see other reasons, right? So they want to help you. So they latch on to anything that's even possibly there. And they're not hiatal hernia experts, right?
True.
So they're saying it could be this because we don't see anything else.
Right.
We don't see the break in the tear. We don't see a muscular problem. There's no actual abdominal wall hernia. Your organs look grossly normal because the CAT scan shows, that there's no cysts or masses. Your gallbladder is not inflamed in any way. So, they have to kind of follow the only leads that are available to them. Right? That's how medicine works.
Okay, and in your case, you're an expert on hiatal hernias, and you don't believe that's what it is. You also looked at my current CAT scan, and you're pretty sure it's not a tear in any kind of artery or hematoma.
Oh, no, the abdominal wall is perfect. And I look at abdominal walls all day long. I can send off testing for the gallbladder and testing for the esophagus and stomach. There is always a possibility we find something like one gallstone. And we take the gallbladder out, and your pain doesn't change at all because you're not a classical story of, this pain after eating, this indigestion, this sort of like, I can't even eat pizza anymore story that people have, and you're not fat. So,
Well, I'm definitely heavier than I should be, but okay.
yeah. I mean, it's one of those things that, like, do we want to go down that road? I'm happy to.
Well, first, I mean, I hear what you're saying. Let's say it's one gallstone, some rogue gallstone, and nothing would change that. At least we know the answer. At least I'd be able to rule anything else out. Even if it's beyond your expertise, what do you suspect it might be? I mean, if it's not the abdominal wall, if it's not.
I think it's musculoskeletal. I think it's a musculoskeletal problem, and I think I don't do musculoskeletal, and it's musculoskeletal very hard to treat. Meaning it's a muscle strain, it's a back strain, it's a nerve problem. Those seem more likely to me, but I am willing to get testing on other internal organs if it makes you feel more at ease.
Well, yeah, it would. It would make. I wouldn't be opposed. But then, where do I go from here? If this isn't your expertise, who would I see, or is it just something you got to live with? You're telling me, in your opinion, you think it's just sore muscles, basically, or is there something? Another specialist? Who would you send me to?
Well, there's got to be something about your rectus muscle that's unusual. If your coughing led to hematoma in the past, right?
Right. I thought there was a connection between the two. They told me, okay, but yeah, continue. I suspect, I could be wrong, but I suspected, because that's what it feels like. So even though there's no tear this time, yeah, it's okay. I'm no doctor. I'm just speculating.
No, I know. I'm just trying to think because I don't do that. Generally, people will see, like an orthopedist or sports medicine. Sometimes, they'll do their physical. Sometimes we'll end up getting an MRI. These things are fairly slow healed. They'll go to physical therapy. They'll get stim. Like those kinds of things. This is a slow game. But that's sort of like the reality with musculoskeletal stuff. Why don't we just order an ultrasound of the right upper quadrant anyways? We can look at the gallbladder. But if I find a gallstone and there's no signs of inflammation, that's fine. Gallstones can happen to anyone, and they're not like they don't cause any pain alone.
Right. So even if you find a gallstone, that might not even explain what's going on here, is what you're saying.
No, but at least it gives me, it's a very, non-invasive, non-expensive for, it's not free, but it's like a very simple test to get to sort of take the most common thing in the right side out of the equation. And CAT scan is not very sensitive for the gallbladder unless it's like a really thick gallbladder. So that's at least a contribution I can make.
Right, so you'll at least be able to see the gallbladder better. Maybe it is the gallbladder, but we couldn't see it on the CAT scan. Okay, like you're saying. Maybe.
I'm
maybe.
not convinced, but, I think it's my due diligence to get that.
Right, okay, so you want to do an ultrasound for the gallbladder.
Do you drink coffee?
No, I do drink a lot of iced tea. I drink unsweetened tea. It's unsweetened black tea. No lemon, no sugar. Yeah.
And you get a little bit of burning when you...
Sometimes not with the tea. Sometimes in the morning when I get up, I might have some acid reflux or some. Yeah.
Okay. So since your reflux symptoms are sort of, I would consider them in the mild range, but the real range, the best person to work that up is a gastroenterologist. So I think do you have a referral for GI?
That's a good question. They're ER recommended among things to do, but there's no actual referral. No,
I'll put a referral for one of our people.
Okay.
So when it's sort of like mild, they have more expertise in sort of teasing out some different things before they jump to like big conclusions. When it's really severe, then a surgeon will kind of take over. But since they have a lot more talent in that area, I'm going to let them drive on that.
Okay. Well.
Because both hiatal hernias, if they cause acid reflux, they're managed non-operatively. I think 90% are managed non-operatively.
But you just said this probably isn't a hiatal hernia from what you're.
Well, the belly pain is probably not, but the acid reflux and the finding of a hiatal is something to follow. It's part of your medical history now, and I think teasing out one thing from the other is important. Are you having a lot of coughing? Do you cough a lot?
Sometimes. Well, I vape. That might be part of it. So.
Okay. Well, only because really bad refluxers cough a lot too.
Oh. Well, you think maybe I do have a hernia, but it's not. Maybe I do, but it's not the hernia. The hernia is a secondary thing, and this is something else. Or
Yeah, so when you diagnose a hernia only on a CAT scan, you're just speaking in a like a mechanical way, like you see a little bit of stomach sort of above the diaphragm, but sometimes that's like a snapshot in time while you were swallowing or moving, and sometimes that is real, but we only care if there's symptoms. Unless it's a giant one, like we see like the whole stomach in the chest, those are different.
so, what are you seeing? Are you seeing at least some sort of hiatal hernia, like a minor hiatal hernia?
I think, yeah, I mean, you technically have that diagnosis, but that doesn't mean that we need to.
Well, no, I have the diagnosis. That's what I'm asking. As an expert, you see the hernia. You say there is definitely. You could.
I see a little bit, yeah, like a little bit of stomach there.
And you think that's but.
It's just notoriously like inaccurate though. So if we do like some of these other studies, sometimes they'll say they don't see anything. It's like, oh, okay. So,
Right, and you don't think that very minor hernia is what's causing this, but
hiatal hernias don't cause pain; they cause GERD. They cause reflux. They don't
Okay.
cause pain. Yeah. Gallbladders cause pain, not really the way you're describing, but they do cause pain.
so then you just think this would have pulled muscle, or will this get better? I'm gonna have to deal with this the rest of my life, or what am I dealing with here?
Because there's nothing like we're like deducing, right? And there's not a lot of other things. So then I would also go down that musculoskeletal pathway and talk to probably sports med, like orthopedic sports med, not family med sports med, if that makes sense. Because then they can examine you and kind of take you down that pathway. So we'll work on things simultaneously because we're running out of things in that area, and no, you should never live with pain. No one should suffer. But I think looking at it from different angles is more efficient.
Okay, so what's the next step then? You want to do the gallbladder ultrasound, and you want me to see a sports medicine,
NG guy. Yeah.
or is that the same as the gastro whatever?
Yeah.
Okay, enterologist, yeah.
If you have any trouble getting a GI appointment, they're going to call you when it's in our systems, like the scheduler. But if they say, oh, it's in October, just send us a message because we can always work on trying to get you in sooner. Because sometimes the schedulers just look at, they don't try as hard. So, any office, it's hard to get sometimes something soon.
By the way, I know you're a surgeon. What is your title, your specialty? Like I can tell, I'll tell the sports people, ER, my regular GP, and then I saw you're a what?
So I'm a minimally invasive general surgeon.
Okay, minimally invasive general surgeon, and you're saying based upon your expertise, this doesn't seem like it. One thing I do worry about the hernia. If you do see a minor hernia, couldn't that eventually cause problems with like the muscle wall closing up on the stomach or something like that? Or
So hiatal hernias are like very different entity than like abdominal wall hernias. They're just both called hernias. But hiatal hernia, we already have that hole right in our diaphragm. So our diaphragm is separating the chest from the stomach, from the abdomen. So your lungs and your heart are in your chest, but your esophagus travels behind them, and then it goes through a little tiny opening to become the stomach underneath the diaphragm. And there's laxity in that opening, but there's nothing sudden. This is a very gradual, slow, nagging process. This isn't like a sudden. Whereas sometimes when we talk about abdominal wall hernias, we do talk about something suddenly getting stuck. That's different.
this isn't an abdominal wall hernia in your opinion? It's just a minor.
Abdominal wall is amazing.
Right. Okay.
Yeah. No, that's the first thing I study because that's the majority of my practice. So, and sometimes radiologists don't study the abdominal wall when they're looking because they're looking at the organs really closely. I really stare at that and have just a really perfect abdominal wall. You wouldn't even know you had that problem 2 years ago. It looks really good.
Okay.
Yeah, and there's no. I also looked at the groins, inguinal hernias, and those are normal. So, yeah, it's a tough case, and I wish I had some smoking gun for you. But we'll go through some different approaches and see what we find. How does that sound?
Sounds good. So what's the next step then? The ultrasound for the gallbladder, or referral for a sports medicine, or?
Yeah,
Okay.
I know that scheduling for GI will call you. I can't guarantee that sports medicine people will call you, so I'm going to get you a phone number just in case.
Sure.
I haven't worked with them as frequently, so let me just make sure you have my contact info just in case. I'm going to put it in the chat.
Okay.
But no, you will not die of a hiatal hernia suddenly. Don't worry.
Oh, yeah. I'm not worried about that. Would that be a problem if it can be taken care of? I'm not opposed to surgery if fixing that will, help.
Oh, no. There's no indication for surgery.
Oh.
Yeah. Like I'll barely diagnose it. Nurse line. Okay, well, I'm sorry about the technology, and I'm sorry you don't have a quick fix. But if there was something to operate on, I would be doing it because I like to operate. So we will figure out, slowly what this is.
Okay.
All right.
So in the meantime, I guess I'll hear from a nurse or something, or I'll hear from, a secretary.
Yeah, so you're going to hear from scheduling from the imaging center.
Okay.
You're gonna call to get your ultrasound scheduled, and then you're going to hear from GI scheduling. Usually these things take about 48 hours, and then
Well, I'm sorry, what's GI? One's for ultrasound. What's the GI scheduling?
so that's to say hey, we're going to make an appointment with the gastroenterologist for you.
Oh.
And then I have to find the referral for sports med for you, but they should call you too.
Right.
If they don't, let them know.
So sports med is so you want me to see both a gastroenterologist and a sports med? Okay.
Correct. All right. We'll get it sorted out. Where are you closest to? Where do you live? Okay, it's in the
Central Jersey area.
Okay. All right. I'll put something in that makes sense then. I just have to do a little research on this one. Okay.
All right, and then I'll hear. I'm sorry, one more time. You're gonna be 2 prescriptions, one for a gastro, one for sports med, and I'll get that.
Yeah,
I'll get that.
They're electronic. So
Right.
You probably won't. If you see something in my chart, but you won't see a paper. But they go directly to the scheduling department of those facilities, and then they call you.
Okay. All right. Sounds good.
Alrighty. So, I guess we'll talk soon about the ultrasound.
Hopefully. Okay.
Hey, nice meeting you.
You too, Doc.